We all know that pregnancy and childbirth is a joyful occasion, but there can be concerns and complications that occur. And did you know that pregnancy-related complications in Black women are more likely versus white women? Well, our sponsor, the Detroit Medical Center, is home to obstetric specialists who can provide care for the most complex pregnancies. And joining us to talk about reducing the risk for complications associated with pregnancy is Dr. Rebecca Jamison, an obstetrician gynecologist at the DMC. Thank you so much for being with us, Dr. Jamison.
Thank you for having me.
So let's start with talking about, the most common concerns that we see in the disparity in pregnancy-related complications in Black women versus white women. What are some of those complications?
So there are many reasons that we see disparities between Black and white women during pregnancy, and the complications that can occur, some of them are social, so lack of insurance or lack of quality care providers in their area, lack of transportation, adequate housing, difficulty with food security. So we have those issues, and then we also have the medical issues. So Black women are at a disproportionately higher risk than white women to have some chronic medical conditions that complicate pregnancy, such as hypertension, cardiovascular disease, obesity, and diabetes.
So with so many factors that can increase the risk for pregnancy-related complications in Black women, what should women know about reducing the risks?
So, it's difficult to reduce the risk for some of the social factors,
right?
But the medical factors we can definitely reduce risk for, and part of that is by having care with a primary care provider before a woman is ever pregnant. So making sure that any of those chronic medical conditions that a woman has are well taken care of prior to pregnancy. And as an OB, I offer patients preconception counseling visits so that they can come in and talk about their individual risks and go through the medications that they take, make sure that we are optimizing their health before pregnancy. And during pregnancy, we want to make sure that you're having adequate prenatal care and that you're going to those visits, you're getting those ultrasounds, getting those labs, making sure that you are staying healthy through the pregnancy. And you also want to talk to your doctor about the facility that you're going to deliver at to really make sure that if you have some of those high-risk conditions, that you're delivering at a place that can support the safest delivery for you and your baby.
All right. Now, we've also been hearing a lot more about using a doula for this process. What services do doulas offer, and what does that help reduce in the risk of complications during pregnancy?
Yeah, so a doula is a professional, clinical, non-medical support person. So they offer a lot of emotional support before, during, and after the pregnancy. And we know that using a doula during pregnancy reduces the rates of C-section. It lowers anxiety and depression during pregnancy. It improves pain control during pregnancy. And it also allows for better communication between the patient and the healthcare team. And doulas are covered by most insurances, so even Medicaid, check with your insurance to see which providers are in your area.
Awesome. Now, let's talk about the use of birth plans. Now, those can be helpful for women, and what should be a part of that birth plan to help with a safe delivery?
So birth plans are a great jumping off point. We use them in the office a lot, and most doctors or facilities have their own version of a birth plan that shows which things are offered there. And some of the most important things to talk about in the office before you get to the hospital are your options for pain control, your options for monitoring during labor, what type of support and the amount of support people that you're going to have during your labor. So it's best to talk about that beforehand and be flexible with that plan, because things can change pretty rapidly, and we all just care about making sure that we have a healthy mom and baby at delivery.
That's right. Dr. Jamison, thank you so much for being with us today.
Thank you.
We appreciate you. So you can learn so much more about the DMC birthing centers and find an OBGYN that's right for you. Just go to dmc.org/pregnant. Again, that's dmc.org/pregnant.